Since the establishment of the World Health Organization (WHO) on the 7th of April 1948, every 7th of April each year is set aside as World Health Day. In its celebration of the 76th World Health Day with the theme My Health, My Right, ABUAD Multi-System Hospital partnered with Triple Green Environmental Development Foundation to commemorate the event. In his welcome address, the head of community medicine, ABUAD Multi-System Hospital, Dr. Agbana, defines health as a state of complete physical, mental, and social well-being, and not just the absence of diseases and infirmities. Dr. Agbana defines clinical and non-clinical determinants of health to include but not limited to medical, genetic, nutritional, lifestyle, and work-related factors. Non-clinical determinants of health are environmental and social factors. According to Dr. Agbana, medical practitioners at the primary, secondary, and tertiary levels pay attention to clinical determinants of health while neglecting the non-clinical determinants. Dr. Akinyemi Akinyuga, technical advisor to the Ekiti State Governor on ecological matters, speaks on health and environmental issues in the 21st century. He draws a comparison between health and the forest, which, according to him, regulates the climatic conditions and provides most medicinal needs.
Health and forest. About 80% of medicines in developing countries are derived from the forest. Both the legal and the illegal ones, agbojedi, the ones that the medical guys don't want to hear about, and the ones that you want to hear about, they are all derived from the forest. Even in the developed countries, at least about 25% of medicines are plant-based. So when you destroy these places, it has a direct implication on people's health. The forest is a place with a lot of beautiful and very nutritious plants. And as you begin to degrade these places, you begin to cause problem for people's health. I was in IITA last month. And of course, I know the medical guys will not encourage this. I also do not encourage it. We saw a plant. There was a forest guy taking us around. And he caught a particular plant and put it in his eyes and said, this particular thing, if you use it every day, you wouldn't have eye issue. That he used it to treat his mom's glaucoma. Now, I had a friend, we went together. He's been having these eye issues for years. If he's in this place, he will wear dark goggles. He can't glare. He has a problem with glare. And he's been dealing with it with glasses and all of it. So he decided to experiment. In the mornings, when we wake up, he will go follow this guy, cut the thing, put it on his eyes. By the second day, the guy could take off his glasses in the room and he could see better.
He identifies unusual heat, flood, waste, and pollutants, cluster settlements as environmental issues that affect health adversely.
Extreme heat. How many of us observed the kind of heat we had this year in Ekiti? Has anybody seen that kind of heat before? In my lifetime, I've not experienced anything like that. That I had to move out at a point and stay outside when there was no power. I had to stay outside of my normal abode. It was incredible. The other one is flood. 2022, there was a massive flood across the country that claimed a lot of lives. And you know, typically, as we in Nigeria, if you hear that 500 died, you are sure that you need to multiply by a number of factors to know what the actual figure is due to our data gathering capacity. Of course, waste and pollutants. 9 million people linked to the death arising from waste and pollution management issues. And these issues continue to evolve and expand as urbanization and population increase. And that's one of the reasons why we know that unless we begin to act differently, these issues will not be different.
Using housing types as a reference, Dr. Akinyuga opines that neighborhood design can influence physical activity levels, travel patterns, social connection, mental and physical health, and well-being.
There are several aspects of the built environment that impact on our health, and I'm not ready to go through all of it. Things as mundane in our site as neighborhood design. The way you design neighborhoods can have significant effect on people's health. Housing types, transport, a lot of these things can have significant implication on people's health.
Dr. Akinyuga further states that mixed housing types, where both the elite and commoner live together, promote good social interactions.
Neighborhood that encourage social interaction, good mental well-being. A lot of times we love to live in posh areas, isn't it? Government reserved areas. But you know that when housing is segmented and gridded according to income levels, you begin to develop a population that may begin to have mental illnesses. And when they begin to know that, you ask for where do you live? I live at so area, you just know, this person is categorized into this social income. And then the opportunities for him begin to lower. You wouldn't want to interact with him because of his postcode, because of where he comes from. And his opportunities and what he has access to begin to shrink. You would notice that societies where mixed social interactions are allowed to take place progress faster and develop healthier children.
Dr. Akinyuga discloses that the Ekiti state government has signed a memorandum of understanding with the United Nations Habitat on urban development plans to replant the entire state and encourage a city-friendly design beginning from the state capital, Ekiti. Also, as a way of discouraging large-scale farming, which requires the clearing of large expanses of land, which in turn affects the environment, the government is embarking on agricultural redesign from large scale to compact and eco-friendly format.
In Ekiti State, we've signed an MOU because I need to also tell us what we are doing as a government. We signed an MOU with UN Habitat to replan the state, beginning with the state capital. The governor recognizes that this is an issue not only for now, that is going to become a very, very important issue to deal with, even more than health issues in the years to come. So we've started. We've developed the concept. We are getting the buy-in. We are engaging stakeholders to replan the entire city, know what we have now, and encourage, a city-friendly design that would not only be built for residents for now, and also in the future to come. There are also initiatives we are taking in the agricultural space, because large-scale agric is a problem to the environment because it involves land clearing, massive land clearing. If you want to have large-scale commercial agriculture, there will be a level of land clearing, massive one, which can be detrimental to the environment. But you can have a way to design these agricultural activities to be compatible with the environment so that we have a resilient environment.
A panel session discussed the conditions of a health-friendly environment as proper waste management and recycling system, flood control mechanism, regulated felling of trees, approved building plans, and the incorporation of more citizens into the health insurance scheme.
Your economic status is a determinant to the kind of food you eat, to the kind of house you stay, to the orientations of your house, and so many facilities that you enjoy, even your access to health.
On waste disposal, we should not leave it to government alone. It should be individual responsibility. Why do I say it's individual responsibility? When we see, okay, within this environment, within ABUAD environment, you have means of disposing your waste responsibly and sustainably. But if we go out of these premises, there are a lot of people who want to dispose their waste anyhow. Meanwhile, the government has provided some, I think, last waste bins. When I was coming on my way, I saw one at one junction on my way to this place. We should encourage people to make use of those things. Apart from that, there are private waste collectors that, at least if you could get the number of these people, you give them the waste, they will come to your premises and pick your waste and dispose it in the appropriate place.
The first intervention I would like to mention is the social health insurance. All right, that we know here in Nigeria as the National Health Insurance Scheme, which has actually been changed to National Health Insurance Authority. Yes, now NHIA. All right, and this was the NHIS, formerly NHIS, was brought on to provide access to healthcare. All right, to quality healthcare, so as to prevent individuals from suffering financial risk, catastrophic health expenditure, and poverty. Although the NHIS might not have covered a large proportion of the population, but we can say that the few proportion that has been covered have had access to healthcare.
In 2008, there is a particular teething mixture named My Pikin teething mixture. Through loudness of health workers reporting, shouting for help, we were able to identify that there was a particular teething mixture named My Pikin teething mixture that killed over 111 children. Was manufactured by Barrowell Pharmaceuticals, and eventually the people involved, the scientists, the pharmacists in that they were probed, they were jailed in 2013. Also in 2010, there was an incident in the north, lead poisoning from children, amongst children. The level of lead found in their blood was above 100 nanograms per mil, or microgram per mil rather, and they were able to identify this and give them chalatinidine, so some children died, but eventually that was curtailed as a result of illegal mining. In 2014, I was supposed to write exam, and that exam was postponed as a result of Ebola outbreak. A man named Patrick Sawyer came to Nigeria, he smuggled himself in as a diplomat. And because a doctor who is just an endocrinologist, this woman sacrificed herself, Dr. Stella Adadevo. She was able to know that this is an infectious disease. And that year, within a year, Nigeria was ranked among the best in the world as regards infectious disease index, because that we can prepare and we can respond rapidly. And everybody, too conscious of themselves, they were able to, everybody was able to do the right thing as regards touching patients, as regards curtailing Ebola. And also, when we looked at, in 2020, a Chinese doctor, or 2019 rather, towards the latter part of that year, before COVID-19 spread out to the world, that guy was shouting in China. He said there is a virus. There is a virus that is killing people. That is killing people. They didn't pay attention initially. Through that time, people could have closed their borders. And eventually, the virus spread to the whole world.
In his closing remarks, the Chief Medical Director, ABUAD, Dr. Kolawole Ogundipe, outlines 5 components of a good environment as fresh air, pure water, efficient drainage, direct sunlight, cleanliness, and sanitation.
These are things seemingly lacking that we should actually be demanding the right of. So if we consider health our right indeed, and it's something that we should take as a right. It's what we are doing here today is to actually sensitize us to be able to demand of those who are the authority holding the right on our behalf. So it goes right to us.
In line with the theme of the World Health Day 2024, My Health, My Right, Dr. Ogundipe admonishes the public to advocate for the right to good roads, good town planning, good water supply, good sewage system, and not just a demand of increment in salary. Peter Agbo reporting for Puff TV.
People of the Fountain.